Hi friends, this is Dr. Sukhdeep. I'll be talking about the various aesthetic procedures which we carry out in our dermatology clinics for treating active acne, acne marks as well as acne scars. Firstly, for active acne, we have peels as well as the Q-switch Nd:YAG laser. Now, the peel best used for active acne is a salicylic acid peel. It is a fruit acid peel. It is derived from alpha and beta hydroxy acids. The chemical peel, basically it's applied to the superficial layer of the skin. It leads to repair, remodeling and rejuvenation of the skin. Salicylic acid peel is applied for 3 to 5 minutes, then it is neutralized, followed by a oil-free moisturizer and an oil-free sunscreen. Please don't indulge into any kind of facial, steam or sauna bath immediately after any kind of chemical peel or any kind of laser, because it can induce redness and irritation on your face. Then the other procedure is the Hollywood peel. Hollywood peel is basically carried out by a Q-switch Nd:YAG laser. Firstly, we apply carbon lotion on the face of the patient and then we give few laser passes. This immediately shrinks the oil glands, it shrinks the active acne, takes away the blackheads, whiteheads, excess oil from the face. It gives a lightened, brightened and a rejuvenated skin tone. The laser sessions can be repeated once in a month and they can be carried out 3 to 4 sessions, followed by a sunscreen and oil-free moisturizer. It's relatively painless, free of any side effects. The peel has to be carried out at fortnightly after 15 days and it can be carried out minimum 4 to 6 sessions can be there. For the laser, it is carried out once in a month and 3 to 4 sessions are good enough. Both the procedures, the care remains the same. Please don't indulge into any kind of facials, scrubbing or massage on your face. Don't go for steam or sauna bath after these procedures for at least a week's time. Then we have the acne marks. They are usually the dark spots which are left when the acne heal, when the pimples heal. So the best peel for this is the Sama peel, that is a combination of salicylic acid as well as the mandelic acid. Then we have the Miami peel, which is a combination of salicylic acid, citric acid, vitamin C, green tea extracts and various antioxidants. Miami peel is a peel which is leave-on peel. It is left for 5 to 6 hours and then we can neutralize it. It gives very good results when we are treating acne spots, acne marks. Then we have another peel which is derived from vitamin A. This is known as a yellow peel. It's basically a cream-based peel. It's a leave-on peel. We leave it overnightly and the face is washed the next morning. What we notice is on the third day, mild exfoliation of the skin is there till 5th or 6th day, and in a week's time, we get a rejuvenated skin. There's a significant reduction in the oil content, in the open pores, as well as the acne marks on the skin. So the precautions are the same: oil-free moisturizer and oil-free sunscreen. Sunscreen for the summers, best is I would recommend a gel-based sunscreen which has an SPF from anywhere between 15 to 30, because we all have Asian and brown skin, so that is good enough for our skin. Sunscreen which is physical can be applied and we can step out immediately, whereas this chemical sunscreen has to be applied about 30 minutes before we step out, and it can be repeated after every 2 hours. So those people who are swimming or who are playing sports outdoors in the sun, they can always wear a water resistant gel based sunscreen. Now we have the treatment for the scars. Scars are basically the pits, they are depressions which are created when the inflamed and infected acne are not treated properly. Secondly is when we fiddle, we try to scratch or we try to scratch and touch our pimples again and again. So it leaves the scars. So basically they have to be filled up with a cementing material. The cementing material of the skin is known as a collagen. So either we can do a fractional carbon dioxide laser or we can do derma rollers for this. Both of them, they induce the production of the collagen, which acts as a cementing material, which fills up the pits, fills up the depressions in the skin, so we get a remodeled and a softened skin. Now, fractional carbon dioxide laser is carried out once in a month. 3 to 4 sessions are good enough. Redness and burning is definitely there. To avoid it, we apply a local anesthesia cream and then we give laser passes, followed by a sunscreen and ice packs. Then we can also indulge into derma rollers or derma pen. These are the devices which have micro needles in them, and when they are moved on the skin in significant directions, they induce micro injuries, micro trauma, which again gives a push to the skin to produce more collagen. New collagen is formed which fills up the pits and the scars. So we have these two main procedures, the fractional carbon dioxide laser or derma roller or derma pen for the scars. Now there's another common complaint of the youth, that is the open pores. The best modality to address the open pores is a microdermabrasion. I usually combine Q-switch Nd:YAG laser also with microdermabrasion. Microdermabrasion is a very basic, simple procedure which is carried out in a dermatology clinic. It basically, the probe is moved in to and fro directions. It acts as a scientific scrub. It takes away all the dead skin. It takes away the impurities, the dead cells of your skin. It gives a bright and a shiny and a youthful look. So it can be compared to a sandpaper which is rubbed on the furniture. It gives a glazy and a glossy look. Similarly, when we do microdermabrasion, we get a very softened and a shiny look on our face. Again, it can be repeated after 15 days. It's very safe. The only care required is the sunscreen and oil-free moisturizer, and 4 to 6 sessions are good enough. And if you want very good results, then you can always give 2 or 3 passes of Q-switch Nd:YAG laser after you do microdermabrasion. I hope this information is fruitful to you. Thank you.